En este caso vamos a hablar de las indicaciones
We'll be talking
posteriores a la
about
iridoplastía
indications after photothermoablative iridoplasty.
Para lograr un poco más o mejor la
To
explicación,
achieve
cambié
or
un
to
poco el
better
tema
clarify
al papel de las
the
células de
topic,
Cogeney.
I changed my title, The Role of Cogeney Cells in Photothermoablative Iridoplasty, because we know little about the immunological role of those. Treatment is effective for a gradual change in color, but little do we know about changes in the iris after the relevant sessions. We will talk about biochemistry. Melanin comes from the action of tyrokinase, which depends on the binding of DHI, and the oxidiol carboxylated or non-carboxylated. Carboxylated on the left-hand side, which is lighter, non-carboxylated is a darker color. So with both comparison parameters, we will see that in these images here, there are some clumps which are Cogeney cells, which are macrophages that phagocyte the pigment that we destroy or that we injure in our sessions. And this is the most relevant thing, in fact. When I see my patients, and whenever we have a new ophthalmologist, we tell the physician that the most essential part of treatment is consultation, the conversation with the patient, because that will end up in a highly predictable treatment and really excellent results. So, when we have our patients in front of us, we tell him or her about the passive stage. This lasts for 10 days, and repigmentation occurs. And 80% or more of the patients tell us the eye became darker, and we tell them, be careful because there may be inflammation, and that leads to darkening. And 10 days later, the Cogeney of macrophages phagocyte the pigment that was damaged with the laser. And then we have the cascade on the left. I will not go into the detail because I'm running out of time. And what we do after the session leads to changes in the patient. And there are many factors that can be changed, and that can change the epigenetics of the treatment in this case. That is most important. And back to biochemistry, glutathione, N-acetylcysteine, vitamin C, and many more elements. And it so happens that dermatological papers show evidence of the fact that melanin can be phagocyted or limited in its reproduction whenever injured, like in dermatology with the laser, with the YAG laser, the 4 nanometer laser. And after inflammation, there may be repigmentation. And there are components which are also found in dermatology, like L-tyrosine, copper, and He-Shou-Wu, which is a Chinese component that we discovered in a patient who used it for capillary repigmentation. So all components intervening by raising the production or the function of tyrosine kinase to increase melanin production will also play a role in our treatment. And we may have this picture. At the bottom, iris macrophages play an active role in depigmentation post-laser. So we can optimize the process. Our process, when we talk to the patients, we tell them we have 3 goals: eye, health, then to have them happy with the results, and third, to reach the best results with a lesser number of sessions, although patients sometimes believe the opposite. In our clinic, we don't talk about grades because grades are highly subjective, and changes between patients are also subjective. But for you to see the patient's color, coffee with some darker or lighter points, this patient in 8 months achieved that result. This patient didn't want to follow the supplementation protocols and all the protocols we have in the clinic to improve the results. This is the same patient. Let me show patients who did accept protocols. This patient achieved this result in 1 month. This is the same. This patient in 3 months achieved that result. You see, compare her with this patient. And the last patient, see the color, the original color here and there. And the last patient who followed all the supplement, all recommendations. Originally, the color was far darker, and that was the end result in a period of half of the time of the first patient. So, patients who follow the protocols with the epigenetics, if we aim at optimizing treatment, they will have less treatment and this is what we aim at with the laser, and achieve a better result. This is the literature, but all pictures in our center were taken in dark rooms, same chambers, same memory, same amount of light. This was taught to us by a professional photographer to control all luminic aspects and any different problem that might arise. Thank you very much.